Hello and welcome to this discussion on epidemiology, population health, health, and public health. On first glance, a lot of these terms seem like they would probably be relating to pretty much the same thing. And you're right that they are absolutely all related to each other. I'd like to give you kind of my take on these terms and how they're each a little bit unique, and then talk about the value in thinking about kind of a timeline for public health. So health is a state of being. Health is not just the absence of disease. I think you'll hear a lot of people kind of talking about that concept lately. It's not just saying that you're not sick, but you're moving in the direction of being healthy, and that can be healthy physically, socially, emotionally, spiritually, in very many dimensions. And so there's that concept of health and well-being. Population health then is related to how health is on a population level, so the health of that larger group, a whole collection of people, the health of that particular group. So health can be on, usually when we say health, we're talking about on the individual level. Health can be on the population level. And then I've mentioned this before, that public health really is this organized effort of improving the health at the community and or policy level. So this is the organized effort. Now, epidemiology is related to really all of this, and I like to remind people that epidemiology and biostatistics, as opposed to most of the other fields in public health, are really the servants of the other sciences, and so they are not they're mathematical, and the way we apply them to public health helps us to make those kinds of organized efforts in improving the health on the community or policy level. So epidemiology is studying how health or disease impacts a group of people. So here we are, we're studying them, and if we can study them, then we can provide evidence for thinking about how we would organize this effort to improve the health of the people. So that's kind of, a lot of people ask me, how are health and population health and public health, how are those different from each other? That's my understanding. I would really encourage you to think about each of those and kind of come up with your own understanding of them. The other piece that really helps me a lot is to think about this historical timeline. When I was in high school, I had a U.S. history class, and for some reason I decided that it was going to be a good idea for me to try to write down everything on some kind of a timeline, everything that I learned about, so that I could see what things were happening. Well, pretty shortly into the class I realized that there was so much to write down that it was too much. But there are some things that really are kind of like those hinge points that a particular field or an area, that was sort of a major turning point for them. And as a public health practitioner, it's important for you to understand some of those key things that have happened in the past that have helped public health to become what it is today. And so if we were to think recently, in 2016, something called Public Health 3.0 just came to be. It was a new way of thinking about public health. People had been thinking and obviously planning that for quite some time, but a report was published, and you've seen me talk about that previously. And so I think that as we move into the future will be a very good hinge point, a way of thinking about public health and how we engage in order to sustain this organized effort to promote healthy populations. A lot of people would put the Affordable Care Act here in 2010 or thereabouts. Can I write? Do I have a pen? My pencil just died. 2010. You'll get to see me drawing with my finger for the rest of the time. Okay, so this is the Affordable Care Act. Some other things that were key in the kind of timeline, and we go way back here, obviously this is not to scale, in 1854, You've kind of seen some of the things in the textbook about John Snow on cholera. And John Snow, we'll give just an abbreviation. So there he is. And he really wanted to think about this idea of having an organized effort to really not just impact the health of one person at a time, but to be able to do that for a whole entire population, a whole neighborhood that was suffering from this terrible outbreak, this epidemic, to be able to do that. And there were a variety of different people kind of over time. William Farr, who came up with the whole idea of sort of classifying diseases in a way that we could start looking and studying them, just a variety of different people. I think a couple of the other really important things that have happened more recently, and obviously this is not to scale. This is in 1988. I've mentioned before this the future TF of Public Health, the Future of Public Health, that came out by Institute of Medicine, IOM. And so 1988 was approximately 40 years ago, and is that right? 9, 10, 11, 12? Yeah. Wait, 80, 90, 01, 30 years ago. So that was really a time when we were thinking about what is it that public health can and should be as we are moving into the future. So that's, I think a lot of people consider that sort of public health 2.0, that 1988 time frame. We'd come a long ways, and now we were thinking about what does this look like now that we're kind of delving into the area of chronic diseases. Another very key turning point in the United States was in 1964. And that was the Surgeon General's report, and that was a time that was for really highlighting the impact that tobacco and smoking had on our population. I think a lot of lobbyists or organizations really wanted to minimize or not acknowledge the impact, the negative impact of tobacco, smoking, and other products have on our health. And so for the Surgeon General to come out with a report and just say that we believe that there's enough evidence that we can maybe now start having some kind of an organized effort to address that for our population, that was a turning point. That was something that was kind of like an important place for health for individuals, and also really looking at health on a population level. And they used information from epidemiology to be able to support the ideas that they were putting forth. So as you're going through, we're going to learn about a lot more kinds of things. I would encourage you in your mind to think, kind of place them roughly along a history. Not that you necessarily need to create that thing that I had in my high school years along my bedroom wall, where I was trying to keep track of everything that happened in U.S. history and eventually gave up. But just to kind of understand where the pieces fit together, what was happening at the same time as those things, and why is that such an important piece of where public health is now. So that concludes this discussion of epidemiology, population health, health, and public health.